Hi everyone, myself Mohammed Ayub Ansari. I am pursuing my BE from ISL Engineering College in the Department of Civil Engineering. Today, me and my friends are here to share few information about coronavirus. The virus is very dangerous, which is spreading over the world. So we have to protect ourselves, our family and friends from this virus, and our lives are in our hand. So I request you all to watch the video till the end.
Hi, I'm Viqar. I'm going to explain the effect on poor people due to this lockdown. The ongoing lockdown in the wake of COVID-19 pandemic has affected the lives of some of the most vulnerable communities across the country, such as migrant laborers, waste pickers, single mothers, and daily wage earners. We have to reduce the impact of the crisis on these sections and to ensure their access to essentials and rations. That non-profit organizations are sending out appeals for funds to help you aid these initiatives and connect you with the efforts on the ground. Daily wage earners and laborers, they face the challenge of both social non-acceptance and financial burden. Among the front ends of India's battle against coronavirus are waste pickers who ensures towns and cities are clean and garbage free. But given the nature of their work, they are also among the communities most likely to get infected, and it is our duty to help them in these hard times. If you ever look at the images of overcrowded bus stands that is filled with these people, most of them walking hundreds of kilometers trying to reach home, you will agree that the lockdown has completely ruptured and victimized those already on margins.
And also there is a Hadith Qudsi on giving charity. Bismillah, narrated by Abu Huraira. Prophet ﷺ said, Allah Almighty said, "Spend on charity, O son of Adam, and I shall spend on you."
Hi, today I'm here to tell you about coronavirus. This video is the best image to show how serious coronavirus is. A city in China builds a hospital from scratch and just for coronavirus patients. And worst of all, the fatality rate is similar to the Spanish flu that happened 100 years ago and killed about 50 million people. There is no way that it can be this bad, but it is essential for us to understand the basics. How did coronavirus start? Coronavirus is common among animals, and in rare cases it can be transmitted to human beings. What is the rare case? This is the rare case. A woman in China eating soup of bat. Why would somebody eat this? Why? This is the another rare case. People eating snake soup in China where snake eats bat. Although nobody knows that where this virus has come from, but it has been confirmed that it is a market from city Wuhan in China. So basic advice number 1, do not eat something that looks like this. Basic advice number 2, moving on to the early symptoms, fever, sore throat, cough, headache and etc., and which is similar to the normal flu. I cannot stress enough how important is that if you feel the symptoms right now, you do not go to work, you do not drive anyone in the Uber and sneeze at the strangers. And more importantly, do not travel while you are sick, as it transfers from one person to another.
What I'm about to say might anger most of you, but it's a fact. The global pandemic of COVID-19 has saved more lives than it has been taken. In the last 2 months, because of coronavirus, it is estimated that just in China, 77,000 lives were saved. That is 20 times more than 3,200 people who had died because of this pandemic. But how could the coronavirus save the lives, you may ask? Well, it is only when we are directly faced by a disaster. It is only when we feel as if we are about to die. Then we are able to take extreme measures and change the way we live our lives. As we fighting for the survival, in that moment big companies don't prioritize money, and human by coincidence are better to the planet. All these things made a positive chain reaction. All around the world, the nature is communicating with us. Like in Italy, for example, the canals have not been clear for many years, and the sky becoming blue and more healthy because China's coronavirus shutdown reduces the CO2 emission by 25%. Less car, less airplane, less factories. This is COVID-19 climate revolution, and it is saving lives. Isn't it crazy? But it is estimated that between 4.5 to 7 million people die prematurely every year because we don't care enough for the environment. Air pollution causes cancer and many more climate issues. It is not only killing us but also the animals and the planet. But the coronavirus changed it. Right now, with over 3.96 million cases globally and 275,000 deaths, we live our lives differently. But did we change our lives when scientists told us that we only have 10 years left, or we will face consequences much bigger than those of COVID-19? We did not. That is what disappoints me. Fossil fuel emissions, over farming, and environmental ignorance harms millions of people every day. But government don't take the right measures because they prioritize monetary gain. 10 years from now, we will pay all for it unless take this new state of the world as a new lesson. A lesson that we are capable of taking extreme steps to save our lives. Lesson we are capable of reversing our environmental mistakes. Once we win against the COVID-19, and I know we will, and we need to remember that as a lesson and start over it. If we respond to a climate change as strongly as we responded to the coronavirus, we will be on our way to a safer future. Because there is no immune system strong enough, no vaccine, no quarantine, no special measures that can stop the irreversible results of climate change.
Gentlemen, I want to make it clear that if you feel even 1% sick, cold or cough or fever, please do not put other people in danger. Follow the self-quarantine, wash your houses, kitchen and everything you touch. Wash your hands a lot and don't have any visitor unless you have to get food delivered. And don't go to the supermarkets. Please repeat this for 14 days. So this is a self-quarantine in simple word for everyone. Please follow this and don't put other people in danger. Spread through air and person to person. All it takes is if you are away 2 meters from someone who has a virus and sneeze next to you, it's not a joke. One person can infect hundreds of people. That's why all around the world events are getting cancelled. I see many people who ignore this. When they feel unwell, they go to office and sneeze all over the place. They feel self-quarantine is our best option, and I know it might sound scary, but please don't be scared. Small action can be done by many people. Create a big solution. Thank you.
Let's talk about the facts of coronavirus. Cold weather and snow cannot kill the new coronavirus. Taking a hot bath does not prevent the new coronavirus. The coronavirus cannot be transmitted through the mosquito bites. Spraying alcohol or chlorine all over your body will not kill the virus that have already entered your body. Vaccines against pneumonia are not provide protection against the new coronavirus. Antibiotics are not effective in preventing and treating the new coronavirus.
Here is a list of popular myths that you should never believe in. Believing in them is very dangerous. Garlic can treat the coronavirus. That's a dangerous myth. There is a coronavirus vaccine ready. Unfortunately, that's another myth. This myth is very important. Children can't catch COVID-19. Horribly dangerous misinformation. Hand sanitizer is more effective than washing your hands. Huge myth.
Today I'm going to explain you about what happens when you get coronavirus. let me tell you a brief about coronavirus SARS-CoV-2. It belongs to the family of coronavirus named after the crown-like spikes on the surfaces. SARS-CoV-2 may cause you COVID-19, a contagious viral infection that primarily attacks your throat and your lungs. What actually happens when you hit with coronavirus? The COVID virus must attack the living cells in order to reproduce. Inside the virus, the genetic material is present, which has the information to make more copies of itself. When an infected person talks, sneezes, or coughs, the virus droplets may enter into your body through mouth and through your nose. Once the virus is inside your body, it primarily attacks your throat, your lungs, and your nose. The immune cells are weakened, like in the case of a coronavirus infection. The virus can overwhelm your immune cells. You can develop a lower pneumonia, which attacks your lungs. A pneumonia may cause you difficulty in breathing, chest pain, muscle pain, confusion, headache, and fatigue. You may develop these type of symptoms, and actually it's worse than it. You may also develop severe complications like respiratory problems. Whether you will develop these type of symptoms also depend upon a lot of factors such as age or whether you already have such an existing condition.
Hello everyone. Yesterday I saw this crazy video. This video is of police hitting the people for leaving their home on a coronavirus lockdown. If I did not do any research, I would have just said to myself, what the hell is happening in India? When you see at the global news, you will see to it that most of what we hear about is India's response to COVID-19 is negative. To my surprise, India, the biggest nation, has the lowest number of COVID-19 cases. According to the data collected, only 5 people out of 1 million has got coronavirus in India, and in US it is 1000 people, and in Italy over 2000 people. That's why it is very important that we have to analyze why India is doing better than other countries in the world and not just focusing on the negative news. India, the biggest nation, has took the virus seriously, and they imposed the largest lockdown in the history of our planet, putting 1.3 billion people under a lockdown. There is a lot that many other countries can learn from it. Learn that sometimes we need to take extreme measures to save our lives, and that's what India is doing. If you go on the internet, you will see the most negative news coming from India. The police hitting the civilians, the poverty, the crowded cities with no clear water, and the massive prayers despite of a lockdown. The statistics are very clear on that. But as far as BCG and weather conditions, the severe travel restrictions, early airport screenings, and putting 1.3 billion people under a lockdown before many other countries, that's what India deserves credit for.